I'm Andy. I'm the Chief Technology Officer for A&S. Thanks for joining us for this virtual lunch. I'm proud to have two guests today. We're going to talk you through some stories of the last 3 months predominantly. So I've got Jon from Greater Manchester Combined Authority, and he's going to be going first. And I've got James from North East London CSU, who both of them are going to tell some experiences and some stories from the last 3 months, some of the initiatives they're working on. If everybody could remain on mute, that would be wonderful. Ideally with the cameras off, that'd be great as well. Just then we get full focus of both presenters. That would be great. So without further ado, if that's okay, Jon.
Afternoon.
How are you?
Yeah, not too bad. How are you?
Good, yeah, good. I've spoke to you since yesterday. Anything changed since yesterday, mate?
Yeah, not much other than the shirt.
Other than the shirt, yeah. Good stuff. So where are you broadcasting from today, Jon?
I'm in Warrington at the moment.
Warrington, is it sunny?
Roasting.
Cracking the flags, and everybody's inside on Teams. But I'm sure, hopefully, everyone gets a nice evening out in the sun, because I believe, not to depress everyone, it's raining tomorrow. But anyway, without further ado, Jon, if you would like to share your screen and talk us through the GMCA initiatives. Thank you. Go for it, Jon.
Cool. So, afternoon, everyone.
Just a quick one, sorry, before I just go on mute. Anyone got any questions, bang them in the chat, and we'll just be answering them throughout. So, cool, go for it.
So yeah, as Andy said, Jon Burt, I'm the lead enterprise architect at the Greater Manchester Combined Authority. Just really a bit of background to who GMCA are, first of all. So we kind of have this mantra right across Greater Manchester now of doing things differently as a combined authority, and the first combined authority, the only one with devolved health and social care funding. We kind of seen as kind of a bit of a trailblazer on how regional government can actually be set up, and part of that is that kind of big enough to matter, small enough to know each other, but also there's a real drive to make things happen across the region. So from a size perspective, the economy of GM is around 60 billion. So that's bigger in the whole of Wales or the North East or Northern Ireland. So a very, very large economy, and a lot of the digital and creative sector alone is worth around 6 billion. So we have a large number of organisations that are located themselves into Greater Manchester now. And it's quite a complex environment as well. So from a CA perspective, we work with the other Greater Manchester organisations like Transport and Greater Manchester Police, the Growth Company, and then the Health and Social Care Partnership. But also there's 10 local authorities, trusts, the 10 CCGs, but also further education, higher education, the schools, but then also liaising back with national organisations. So we're doing quite a lot with GCHQ at the moment, who've located themselves in Manchester, alongside NCSE as well. And they're really seen as Manchester as being that front door for those organisations that didn't really engage previously. We've got a strong leadership in place as well. So Andy Burnham's quite vocal across the kind of those regional politics side of things. And the CA effectively is responsible into Andy. We've got portfolio leads as well now with Councillor Sean Fielding, who's the leader of Oldham Council, so he's responsible for the digital portfolio, alongside Sarah Todd, who's the Chief Exec of Trafford Council. And that gives us really engagement back into the other 9 leaders and chief execs across Greater Manchester. So just kind of to kind of emphasize that even further, the number of different organizations involved in that kind of delivery, and really it's coordinating with all of those organizations. We don't have a mandate to deliver on behalf or to them. It's very much working with them to really look at how digital can transform the whole ecosystem of public sector services in the Greater Manchester region. And we kind of take a few different approaches to that. There's some things that we're in direct control of. That's a GMCA-led project where it absolutely makes sense for us to do it across Greater Manchester. And some of the things in there is kind of the work and skills, that kind of the green city region agenda as well, and how we can go carbon neutral 5 years ahead of the national targets can only really be done at a GM level. But then there's other things that we just have, and we're just an enabler of, really, and just bringing people together. And the cyber community is a great example of that, where we're just joining up different organisations that go off and develop something together. In February, we launched our digital blueprint, which had 5 key priorities, which tied back into the Greater Manchester strategy. It's not a one-to-one relationship. What we've found is, because digital is so cross-cutting, it's probably the most cross-cutting of all the portfolios in the GM structure. That we needed our own priorities, and we'll pull out some of those through this, of the stuff that we were doing before COVID and how that's enabled us to react to the COVID pandemic. And then we've got those 2 cross-cutting enablers, so strengthening the digital pipeline, so really looking at skills and retraining people into the digital arena, and that's going to become more important moving forwards as the new norm comes into play. And then the digital infrastructure that actually sits on it underneath, so things like full fibre that we're moving across the city. And as part of that kind of enabling innovative public services, it's really focusing where we look at. So me and Andy have talked about Wardley mapping a number of times, and it's really looking at what, and if you haven't seen it, it's something to look at on YouTube. And also interesting to follow him on Twitter. But it's really looking at where you can add value to the organisation. And more that is moving up the stack. So moving to the top end where it's more business focused and moving away from that traditional IT. No, that doesn't mean we don't do it anymore. It just means commission it wisely or automate it as much as possible, so you can release capacity to focus on where you can add value. And you adopting technical architectures that allow you to do that, so things like serverless and microservices, rather than building up servers in that traditional monolithic approach. So just touch on something that we call the GM digital platform, and this started as a concept about 2.5 years ago, and it had there was 2 separate kind of programs that were in flight across GM. One from the CA, which was around smart resident or unified architecture, and then on the health side they had this interop capability, which later turned into the LICRA program, which is local healthcare record exemplar, which is really looking at bringing together and joining up the various siloed systems, both within an organisation but across a region, and from a LICRA perspective eventually across nationally. So it's really so that people don't have to keep telling the stories multiple times. What we've done is we've brought that together now under a single GM digital platform and bringing together different components that we're both utilising around a number of use cases. So from the CA's perspective, we're looking at early years digitisation around health visiting initially, which is part of the Mayor's aspiration for having children ready to learn at the age of 5. And the data sets that actually allow us to improve that just don't exist at the moment, because a lot of it's paper-based or in siloed systems. The other one that we have is victim support. So that's, again, people working that are going through some that have been a victim of crime, and they'll be liaising obviously with GMP, but also with criminal justice system and a number of voluntary organisations as well. And again, they're having to retell the story each time. On the health side, they've got dementia and frailty, and again, those are very similar to the victim support, where you're having to retell your story continually. Within the platform, we have a number of technologies that allow us to do different things in a component-based architecture, but all of that sat in a new multi-cloud service, so it sits separate to any organisation. So the things that we stand up in the use cases, the actual solutions, are consumed as a service by each of the localities. So they don't have to stand their own infrastructure up. We're not having to put things into their data centres. It's more of that kind of SaaS-based model, all sat on that managed multi-cloud service underneath that we've been working with A&S on. But we kind of get away from the technology now, and we just kind of say it's a platform, it's a toolbox with things in there that we can utilize to solve those use cases. And as we've gone through COVID in particular, what we started to realize is that there's 3 different stages that we're getting involved in. It's either that initial gathering of data appropriately, either through integrating into existing silos of data, or as part of a transformation piece where we're using some low code capability to actually transform a paper-based or a spreadsheet-based service into something that's a lot more digital. We then take data, secure it, store it, provide a single way of authenticating on that cloud-first program, start standardizing those data sets, etc. And then we serve that up either back through analytics or through further integration back into existing systems. So this is the digital platform. This is kind of live now in Greater Manchester. We spent the last year procuring the different components, and this year standing them all up. And the reason that we've done this is really allowed us to accelerate through COVID some of the solutions that I'll talk about in a minute. So just to quickly touch on the main project that we've been working on from the CA is the early years digitisation, which I've mentioned already is predominantly a paper-based process at the moment in health visiting. So what we did using Mendex as a low-code platform is we digitised those 42 multi-page A4 forms that are sent out to parents, and provided a number of different screens for managing cases. So 55 new screens developed, and all of that was done in 20 weeks on a number of different sprints. So I think it was 8 sprints that we actually did, using 170 different user stories that were co-designed with the end service, so with health visitors themselves and with a partner. And we actually commissioned this out to a third party. But using low code, and that allowed us to save around 90% on a traditional app build. So this is a web app and mobile native apps that is used both by the health visitors but also by the parents, and it's predominantly parent led. So we're plugging into some of the NHS identity systems to actually secure those identities. So architecturally, it's very much component based, and we've also built for the future in creating a kind of an app store approach. So early years being the first one there, but we can have that common UI design then for portals that then can interface into existing legacy systems or practitioner based systems. So as I mentioned, we used NHS login and NHS identity. So NHS login for authenticating the citizen, the parents and carers, and then NHS mail and NHS identity for the helpers to actually authenticate all into the same app. So it's very much a role-based access approach. Using the identity access management platform that we've built, and this plugs into existing on-premise Active Directories if it needs to in each of the organisations that we work with, whether that be local government or health organisations. But it also plugs into the national systems that I've mentioned, and it allows us then to have this single capability in the centre within the digital platform that we can authenticate people to apps and services that we stand up. So just quickly go through, this is the early years application from a parent care perspective. So as you can see, it's quite a modern user interface. This was actually an early release. We've actually ready to go live with this now across 2 localities in July. What we're also doing as part of that is actually surfacing up information that they've not had access to before. So that was one of the key parts of the digital platform, was to be able to expose information from other practitioners that are working with those families. We also wanted to automate the creation, so tying back into the patient demographic service in NHS, so we get up-to-date demographic information about those parents and children, and kind of joining up that entire system approach, obviously with the right information governance around that, and we engage our IG teams at the start of any project that we do now, just so that they're involved right from the beginning. One of the pieces of work that we've done as part of the COVID response was around volunteers coordination, and this started with some work in Bury that Nikki Parker's team over there were working on with A&S, and it very quickly became apparent that there was a need for this across Greater Manchester local authorities. And it started off with the shielded list, but quickly grew into other vulnerable categories that were requiring help while they were isolating, whether that be with medication or picking up food. And all we really did was we stood up a very straightforward Microsoft Power App that used the field service capabilities, and just customized that very quickly in a couple of sprints. So we started work with a proof of concept and went live in April, the middle of April. And we've had an additional upgrade since, so a second release on the 4th of May. We're now rolling out very much an enhanced version into Rochdale as well, and that will be backward ported into Bury. That allows it to be two-way, so rather than waiting for people to come to ask for help, we're actually they're actually phoning them up in Rochdale and offering the assistance. So there's a lot more of a proactive type service now. And there's conversations with some of the other localities now about keeping this as a strategic solution around coordination of volunteers for a whole manner of different things in some localities. So this just quickly shows the process from that volunteer capability. So somebody ringing up asking for help, that then going out to a hub where the calls are kind of allocated then to a volunteer to go off and actually deliver the whatever help was requested. And architecturally, just how we stood this up and allowed Bury to move at pace really was we already had the digital platform in Azure, and we just created an Office 365 tenancy hung off the side of that, and stood up 2 new environments for Bury that have the Power App capability in there. That was tied into the Azure Active Directory that actually sits in the Power Platform, and then Bury users were just then invited through a new function app that we created to onboard them into certain roles within the Bury environment. And we're actually extending this out now for a track and trace complex management capability in Dynamics that I'll talk about in a minute. But it's all sat in the same environment, and all the locality needs to provide us with is a spreadsheet full of the users and the roles that they'll take. They then go to a web page, and the function actually populates them into the Azure Active Directory and gives them access to the service. So we can be continually developing it on the test system and then releasing it in production. And it's kind of that evergreen approach that a true SaaS-based service provides you with. One of the other things that we were asked to do is local authorities don't have great data sets around demographics of actual people. It's mainly focused around properties. And there was no capability to understand who was over 70, well, between the ages of 70 and 75 within a local authority. So what we used is the Enterprise Master Patient Index component of the digital platform to match the address-based data set with the unique property references number on, which the local authorities tend to use as their main master data set, with the NHS Patient Demographic Service, which then gives us a very rich data set of demographic information about people matched together with property referenced property reference information, which are a really strong data set that we could then offer out to local authorities, so they could target that help to those between the ages of 70 and 75. And then the last piece that I wanted to touch on was track and trace, which is a massive, ever-changing and quite complicated situation. But I'll try and distill it down into why we got involved and the kind of the user journey. So predominantly everything's done nationally. So the individual, if they have a positive test, and have provided the right contact information, will actually be contacted automatically by the National Testing Service. And this is the 25,000 Serco employed staff that are doing the majority of the track and tracing. And they'll go through a form-based questionnaire, either electronically or over the phone, with the person that's tested positive to try and find out who they've been in contact with. And those people will then be told to self-isolate. What happens though is that potentially some situations are of a complex nature. And when it goes into the national tiers 2 and 3, where they actually look at these in a little bit more detail, they might ascertain that we need some local involvement. And this could be something like a prison or a police station where somebody's tested positive, or there might be some advice required from a school, etc. And those cases can be passed down to a local level. The key thing is that this has been happening. Track and trace is not a new thing. It's been part of Public Health England and local authorities' responsibility for a long time, but it's usually in very small amounts of cases around measles or food poisoning outbreaks. So it's tended to work via email and spreadsheets. But with the number of cases we were potentially anticipating through COVID, some of the modelling suggested it could be up to 1,500 cases a day that were defined as complex. We needed some way of managing those. So we started working with Microsoft and A&S around standing up a Dynamics capability, really to take those requests in and manage those through a GM virtual hub and then down into a local authority where they might need to work with a school or a care home or a residential school, etc. And then we needed to close those cases and resolve them back in the national system as kind of dealt with, but also have that kind of evidence base of what we've done. But there was also the scenario of, if it was a school, the likelihood is they would be in contact with the local authority before it's gone through the national testing, the track and trace service. So we needed the capability of creating cases locally and then joining those up as they came back nationally and resolving those. So that's where we're using Dynamics as well, is to create that local case. These are some screenshots of the original proof of concept that we did, and we've got some hidden YouTube links down there which show you the original proof of concept of cases coming through, being imported from the line list that we get nationally, creating all of those cases, those being then allocated out to a local authority and then closed. We've improved that, so we've kind of got an alpha release that the NES team have worked through over our original requirements that we set out, and we're now into a series of sprints twice a week with the design group, with the aim of releasing our first kind of production release on the 7th of July. So that's kind of gone from proof of concept to initial delivery within less than 4 weeks. And that's me done on the stuff that we've been doing. Whistle stop tour.
Wonderful. Thanks, John. Everybody enjoyed that. So that was a great whistle stop tour of some of the stuff that you've done in the last sort of 3 months specifically and moving forward. So thank you. We've now got James. Over to James.
Hello, mate.
How are you?
Yeah, good. I'm a little bit in awe of John's presentation there. Got a lot to live up to.
Oh, man, I'm sure it'll be fine. John will love that compliment, though. Won't you, John? Yeah. Well, thank you, mate. So, very kind of you to give up your time. So James, like to introduce yourself to everybody and where you're from, what your job role is, what organisation you represent, what you're going to talk through. And again, yeah, if I hand it over to you, I'll put myself back on mute, and the floor is yours.
Cheers. Thank you.
Wonderful.
Hi, everyone. I'm James Davis. I head up innovation over at North East London Commissioning Support Unit, but I have a split role where I head up innovation also over at the Royal Free London NHS Foundation Trust. And so what I'm going to do today is share with you a couple of slides that highlight one aspect of the work that I've been looking at over the COVID period. I think it's fair to say that many of us within the NHS have been stretched and have been doing things that maybe we didn't ever expect we would be doing. And that covers a huge breadth of stuff. My slides aren't as engaging and as great as John's, as I said, maybe a little bit more basic, but definitely gives me something to aim for. A little bit about us as a commissioning support unit. I'm sure that people on the call have a variety of different backgrounds, from local gov to healthcare to a number of other different public sectors or private. We're one of 5 commissioning support units. Not so long ago there was a whole heap more, but they've slowly been whittled down to just the 5 of us. We've got a number of different clients, from clinical commissioning groups to local authorities and trusts. And we provide end-to-end transformational services, as well as clinical support, decision-making, estates, analytics, a whole plethora of things that maybe smaller NHS organisations aren't able to manage in-house. They offload to us as a commissioning support unit. Some of these areas you can see here that we cover. The one that interests me, of course, is digital innovation in the middle. But just to say, as a CSU, we cover about 16 million of the country's population. We only manage about 8% of the NHS budget, which is around 10 billion or so when it comes to putting that into some kind of financial figure. As I said, we work for a number of different organisations. Unfortunately for me, I'm able to spend part of my time with the guys over at the Royal Free. But what I'm focusing on today is what we've done with regards to fighting the pandemic, in particular using Power Apps and the Microsoft Power Platform. So just to set the scene a little bit across both organisations, over at RFL we've got about 15,000 staff, at now about 1,500. And the need at RFL was to make sure that there was a central place for staff to be able to go for information and advice with regards to what it is they need to do if they feel like they have symptoms, or just simply letting us know where they were working, as well as whether they were in work or out of work. You know, the kind of things that we need to do in order to track the workforce, so that if there was anyone that was testing positive for the virus, we was able to very quickly track and trace as to where that was. With regards to now, the ask was slightly different. Of course, we're not necessarily front line facing, but we do have a number of NHS staff that do have a number of clinical as well as non-clinical skill sets. So we was able to surface a form that was hosted via Teams that captured information from our staff that helped us understand a bit more detail than that which we just had available through our HR records. So our status, their well-being, their ability to be redeployed, what areas they could be redeployed to, as well as what kind of clinical or non-clinical skills that they had, and whether they were affiliated with any bodies such as nursing or pharmaceutical bodies, so we could best use their skills and capabilities. Now, at the time, going back to Royal Free, the ask was to build this platform that would almost take a CRM type approach. And at the time, I didn't really know how it is we could put something in place rapidly that would take information from ESR, which is our repository with all of our staff information, and surface that in such a way that it could be interrogated, amended and updated, and have these calls then flagged against them. This is where ANS stepped in, and they offered to give some of their expertise with regards to the Power Platform and spinning up an app that would use this data as a starting point and enable the staff advice line to be stood up. So this is what that looked like, and it was Adrian Woodrup over at ANS that done a lot of this. He done some great work in standing this up for us. And what's really great about it is that the team found it a really clean and easy to use interface. Just by searching on here, we was able to interrogate the CDS, the Common Data Service, that sits as a backend to the Power Platform, as you'll know, which had been uploaded with all the relevant staff data from ESR. So once we was able to find the right person we was looking for, we'd be able to have a look at any of their previous testing results, where they had been, and maybe what they had called about in the past. And we'd be able then to record a new session for that person, depending on their reason for calling, making sure that the team was giving the same consistent advice across the piece. Of course, at the point of this being put in place, everyone wasn't sat in a bank of desks in a big call center. Everybody was sat remotely. Previous to this, the infrastructure at RFL didn't lend itself to enabling this kind of working practice, as we didn't have Office 365 in place, we didn't have an Azure tenant, all those good things that Jon mentioned in one of his penultimate slides wasn't available to us. So we had to work with the team over at Microsoft to spin up a brand new Azure tenant, spin up a brand new Office 365 environment to make sure that all of this was possible and we was able to house it all. So this is what Adrian and the team were able to put together for us. We had a number of benefits as a result. As I mentioned, the data came from the ESR repository that we use nationally. This was then fed into the CDS as a backend, and it meant we was able to produce bespoke reporting, whether that was using the Dynamics capabilities that's built into the Power Platform. Also, we was able to pull the data and load it straight into a Power BI dashboard that I'm sure many of you are used to. What the team particularly enjoyed was that because Power Apps is native to the Power Platform, we was able to surface that app within Teams. So within a single Teams channel, the guys had the app there on a tab, and then on the other tabs, they had all the documentation right at their fingertips. You can imagine the transformation for a team that were used to working on a plain Windows 7, 8 environment with old shared drives on Excel 2010 with no version control, to now having this completely digitally enabled platform where they're able to instantly chat with each other, talk about issues or challenges they have, and interact directly with the app, which was in turn updating the backend database all at the same time. We also manage an RPA platform, so intelligent automation by Blue Prism Cloud, that I look after for the Trust and Nell also. And the app was able to integrate with that seamlessly as well, which was really powerful. And it meant as well that we could completely customize what we needed. Because it's built on the Power Platform technology, we was able to make sure it's completely tailored to our environment. Jon mentioned being able to do things in a number of sprints. It was very much the same for us. We was very quickly able to rapidly deploy any changes or amendments that we was able to make. The staff also felt much more connected. They knew that they had one place to go in to get the advice that they needed, and to be able to make sure that the trust as a whole was up to date with where the staff were and how they were feeling. Given that we're across 5 or 6 different sites with a number of different wards within there, it's easy to lose track of everybody. So that's what we was able to do there. That gave us the platform that we needed to go and do even more. So we was able then to allow people to self-update without needing to contact the advice line. By spinning up another app like this, staff were able to jump into the portal, let us know if they were okay, if they were at work, or if they were off sick, or if they were experiencing symptoms, where these were coming from, when they had surfaced. All of this feeding into our ability to track and trace any potential outbreak within the trust. Further to that was this app, which was spun up specifically for that track and trace. Again, they all benefit from using the same data repository in CDS, so that any update from any one of the apps, that data was able to be surfaced and the intelligence drawn out into those Power BI dashboards, no matter what the issue were. And that's what I think was particularly powerful about that and about my personal journey with regards to C19. Before any of this, I'd never touched the Power Platform at all, really, other than what I suppose most people had dealt with regards to Office 365. But now I'm fairly confident in using Power Apps, and if you haven't used it before, the guys at ANS are really helpful in giving you some tips and tricks and pointers so that you too can spin things up really easy and really quickly to answer your need. Within the CSU, we was able to deploy a staff redeployment app, and that was able to give us a really good overview of our staff, their availability, and as well as their skills and abilities. This again was facilitated by a disparate team, 10 or 15 people working separately, again surfacing this information through Teams using the Power Platform. It had a number of challenges, and this was by no means the first iteration. But as we said before, being able to have the skills and the tools at our disposal, we was able to customize it and make it what we wanted for the purpose that it was needed by us as a CSU and by RFL as a trust. So that's just a really quick journey through one of the challenges that I've had to overcome as part of the pandemic. I'm sure I could talk for a lot longer on some of the many other things we've been involved in, but that's it for today. And thank you for taking some time to join and listen.
Well, James, thank you to you. Very kind of you to give us time to share that story with us. So, and a little plug in there for us as well, which was very kind of you, which we didn't ask for, but that's very, very kind of you. So I'd like to thank, I think there's one or two questions I think we'll chase up later, but in the interest of time, we're right on where we're supposed to be there. So I'd like to thank you both for what you've just shared with us. It's very kind of you to prepare for the day. I hope everybody on the call has enjoyed the last 40 minutes, and we look forward to the next one. So thank you so much, everybody.
No problem. Cheers, Andy.
Take care, guys. Bye-bye. Thank you.